Okay, I think we will go ahead and get started. I wanted to, first off, I'll introduce myself, and I see some of my staff members on here as well. I'll introduce them as well. And before we get started, I want to go over just some brief housekeeping items of how we can make sure that we utilize this time and format to the best of our ability that will help you give you all the nourishment that you need to hopefully get your questions answered. So that being said, I'm Karen Venis. I'm the CEO here at Sarah Christian Village. And the intent of our meeting today is to just provide you with some more information and education on some recent guidelines that came out for visitation and testing in long-term care facilities. Before we get started, I believe we're on, Elise, I see you on here. It looks like this is the first time I've done some of this technology, so bear with me. We are streaming this live on Facebook as well. Elise, do you see it on there before I keep going? I hope I've done it okay. I'm there? Okay, good. All right, so I would, and there's lots of folks that are joining. I'm afraid I'm gonna, hang on, make sure I don't leave anybody out that's not wanting to come in. Okay. So our plan today is just to go over this guidance with you. Just a couple of housekeeping things. If you're on Zoom and you're not familiar with Zoom, I would ask that you would make sure that your lines are muted. That just helps reduce feedback as well as keep everybody on track. So I'm going to mute everybody, and then you have the option to unmute yourself. Additionally, if you want to start your video, and that just means we can see your face, you can choose an option. Whether it's your phone or the device that you're on, probably has a stop video with a red line through it. If you click that, it will allow you to start your video, and that's for all of you that are ready for Zoom video. Some of you, like I said earlier, may not have your rainy day makeup on, and that's okay too. We certainly understand that. That being said, I want to get right into the gist of this. I know that, again, we're going to be on Facebook Live. There's also an option, if you look in your screen, for chat. If you happen to have questions as we're going through this, feel free to use the chat feature. We'll be getting questions from Facebook as well, and I'm hoping that Elise will help feed and filter those Facebook questions for us. I want to introduce, I see some of my staff on here because you guys just, gosh, we simply could not be doing what we've done the last several months without these folks and without everybody on the team. But Ann Reed, I see Ann, she is our VP of Healthcare Services. Ann, you want to just take yourself off mute, introduce yourself for those that faces that tell everybody what you do here. She's muted. There you go.
Okay. Hi, I'm Ann Reed. I'm VP of Healthcare Services, and I'm actually a licensed nursing home administrator. So I'm responsible for the overall operation of the nursing home. So if you have any family over here on this side and you need me for anything, please give me a call. Good to see everybody.
Thank you, Ann. Joe Drum, I see you here. Joe is our VP of Residential Services. So while Ann has responsibility for the day-to-day operations of Sarah Healthcare Center, Joe has responsibility for the operations of Friendship Towers, Bonta Apartments, and Forest View. Joe, quick introduction.
Hi, thank you, Karen. Joe Drum. As Karen mentioned, I have the opportunity, blessed to serve the residents on the housing side and also interact with Ann and her team with residential services at the nursing center.
Awesome. Thank you, Joe. And then I'm going to introduce Elise Hinchman. She is our VP of Marketing and Development. She's the one that helps make us look pretty. I'm kidding. She doesn't give me makeup. She makes me do my own. But no, she's the one that if you see what we're doing on Facebook, all of the information that you see on our website, everything that we do in effort of transparency, she's the one that makes that happen. Elise, you just want to say hello?
I just want to say hi, and I love seeing all the faces on here. And if you do have a question, like Karen said, do not be shy. Pipe up, because this is a great chance to get that answered.
Okay, thank you. And I see some others on my staff, but I see some cameras on, some cameras off. Vicki Phillips is our admissions director. Vicki, you want to wave? Say hi for those of you that are and she's our social services director on unit 3 and 4 here at the healthcare center. So, and then I don't see anybody else. I'm sure there are others on here, but in lieu of time, I want to just get right down to the chase. So, COVID-19, that's one of those things that if we've said pivot 1,000 times, we've said it 1,050 times in the last few days. And so obviously the purpose of this call is just to go over recent guidance that has come up and come out related to visitation and testing in long-term care facilities, and really what we're doing and how we're responding on our campus. And so I'm going to try to keep it in bites and stay at the kind of the 30,000 foot view, because I think if you want us to get too much in the weeds, we'll be here for 4 days telling you about all of the specific things that we have to do. So I just want to give a good kudos to all of our staff. They have worked incredibly hard to respond to these changes as they have come out, and have pivoted quickly and swiftly every single time. So I'm really proud of the work that they're doing. And also want to make sure that we let you all know, as family members and residents and other staff on the call, resilience is the word, another word that we're using a lot. And everybody has been so supportive and so responsive to us. We've done a remarkable job on our campus with how we've responded to COVID, but it's been easier to do with the support of all of our families, our residents, and our staff too. So as you all know, we're almost, it seems hard to believe, we're almost 7 months into this gig. And I think nobody would have imagined 7 months ago that we'd still be talking about COVID in October. So March 6th is when Governor Beshear announced that we were in a state of emergency related to COVID. And that's really when we started putting our plans in place. Actually, March 4th was when we activated ours, but we knew that when we had a case in Kentucky, that would put our plan in place. And we knew when we had cases in Fayette County, that's when we would activate and really go into high motion. And so we've done that. And we have made sure that we've tried to cover every single thing we could to keep our campus, our residents, and our staff safe, and just everything we can to prevent the spread of COVID on the campus. So to give you an update of where we are with COVID cases on the campus, in total, we've had 24 positive cases on our campus. And again, we have 375-ish residents, and we have about 250 employees. So 24 cases is really in response to what other facilities have done. It's really, really good numbers to report, and I'm proud of that. I'd love to say that we're COVID-free, but we know it wasn't a matter of if, it was a matter of when we would have COVID on our campus. So breaking down that 24, we've had 6 residents at the healthcare center. All 6 that tested positive really turned right around and tested negative. 5 of those 6, maybe all 6, and you may want to speak up, but they've all had the antibody testing that said that really showed us that they didn't have it to begin with. And so we could sit here and argue the accuracy of the testing all day, but the reality is, in our world, we have to treat the positives like positives to be in compliance with what our state and local public health officials say. We've had 15 employees at the healthcare center who've also tested positive. This is since the beginning of this. We didn't have any positive cases till June, I believe 11th was our first positive case. So we went quite some time without having any positive cases. The 15 employees at the healthcare center that tested positive, all but 2 of those were asymptomatic, no major issues, and were able to return back to work. And then we did have 2 that had minor symptoms. Both of those employees have since been released and have been returned to work. Just know that when we get a positive case, we make sure we do internal contact tracing. We do external contact tracing, which means we try to find out who these folks have been in contact with in the facility and outside of the facility, so that those folks can be on alert to monitor themselves for any changes in condition or signs and symptoms of COVID. Not all 15 of those employees at the healthcare center, though, were exposed to our residents. We had some situations where employees, maybe they hadn't even started with us yet, they were in orientation. We had some situations where the employee or employees hadn't been in the facility for over 14 days. So of those 15, we can really scrap and count. We can kind of carve out many of those because of their circumstances. But in total, the numbers to be to totally be transparent, those are the numbers. We've had 2 employees who have tested positive at Friendship Towers. Both of those employees that tested positive at Friendship Towers turned right around and tested negative. Again, we could talk for 3 days about testing and the accuracy of testing and what that means, but we have to go on the results that we're given. And then we did have 1 resident at Forest View who tested positive, and that resident was also asymptomatic. So of the 24 cases, 2 of those have been employees with symptoms, everybody else not showing any symptoms, asymptomatic, and of course, no deaths to report. So overall, in comparison to what we're seeing in other facilities in Kentucky, I believe the last count, there's over 335 long-term care, assisted living, congregate living, senior facilities that have reported positive cases. So for us, we, again, it's not a matter of if, it's when, but we're very proud of how we've responded to these cases. And as most of you know, we have a 1-call notification system in place. So when we do have a positive case, we're able to notify you swiftly and quickly of what our status is. Of course, we continue to keep our COVID line, our information line updated, and our website updated on a very regular basis. So there's not ever a time where you're uneasy about what our status is, because we know this is certainly a vulnerable time for family members that have loved ones in settings such as ours. As far as testing goes, we're actually in the middle of testing today. We've conducted 17 rounds of testing at the healthcare center, which, gosh, it's a feat. We start at 5:30 in the morning. We finish at 7 o'clock at night, and then we wait for the results. And I'm not sure what is the longer part, the all-day testing or the wait for the results. We sometimes get results till 2 or 3 o'clock in the morning. And it's we stay on those, watch them like a hawk, so that in the event we have a positive case, if for some reason the employee should be working or it's a resident that is here, we can put plans into place very quickly to mitigate and isolate that individual, whether it's a resident or if it's an employee, make sure they're not in the facility, just to mitigate the spread. So the big thing with testing and long-term care is the number of days that you go without any new positive cases. As we kind of roll into our new visitation guidelines, there's a lot of criteria that you have to meet, but the big thing that you'll hear and see and what we've been following is no new cases for X period of days. And that X period of days, whether it's 14 days or 28 days, it varies. Whether it's visits, dining, activities, there's a lot of things that hinge, but today, most everybody is using this 14 days. I'm not going to go backwards. I only want to look forward, but this 14-day period is what we'll be talking about as we move forward. But that's kind of one of our check boxes we have to make in order for us to move forward with some of the plans that we have in place. So as far as different areas on our campus, it's also important to note that we have many different regulatory agencies for our campus. So as you probably know, on our campus, we have 4 different buildings. 2 of those buildings, which are Bonta Apartments and Forest View Apartments, those are governed by HUD, which is Housing Urban Development. They are low income, senior living, independent living apartments. So they're not a healthcare facility. So while we follow the guidance of CDC and HUD, we're not following regulatory guidance from Centers for Medicaid and Medicare Services. They're just not regulated in that manner. And we've got about 140 residents in those 2 buildings. Their protocol for visitations right now is a little bit different because it's independent living. While it's congregate living for seniors, it is an independent living setting. So the practice over there, and has been for quite some time, obviously we make sure we don't have any current COVID cases. That's the first indicator. So long as we don't have any current COVID cases, then we are allowing in-person visits at those two facilities and have been for a little while now. Those visits are very much structured. So the family member or the visitor, whoever it is that is entering the building, they are screened, they are scanned, they are provided education on COVID and what the signs and symptoms are. They're asked a series of questions. I'm sure at some point, many of you have been through that process, whether it's a doctor's appointment or some sort of medical procedure, or there's today when my kids went back in school, they're doing temperature checks and doing those screenings. So that's going to become part of the norm of what we're doing and what a lot of facilities will be doing as well. But so long as there haven't been any signs or symptoms of COVID, their temperature is below a certain level, they're allowed, the residents over in Bonton Forest View can have 2 visitors in their apartment at a time. The visitor has to wear a mask at all times, and then they have to be basically escorted. They go straight to the resident's apartment and straight out. So we're not using any common spaces or common areas over there. That's what visitation looks like in those 2 buildings. Again, the folks that live over there are, they can perform their activities of daily living on their own. It's much more of an independent living setting. So they're, as well as they have apartments. So they're not as at a great of a risk for COVID as those that are in skilled nursing facilities, such as the healthcare. Friendship Towers is our assisted living facility, and it's governed by the Department of Aging and Independent Living. And so we get our guidance from them. Again, we follow all of the CDC guidelines as well. And a lot of times what DAIL is the acronym for their regulatory agency. A lot of times what DAIL will do is they will mirror or follow what CMS does. You'll see a lot of times they'll say, whatever the strictest guidance with respect to COVID, that's where we're going to follow. So Friendship Towers, they received guidance back in latter part of June that allowed for visits to take place. And what we're doing is we have indoor visits in the lobby, and those are scheduled. They're called Chatterbox visits. And then we have residents that are going out to appointments, or maybe they're going out with their families to visit in that respect. But we are still not having visitors in the residents' apartments at Friendship Towers at this time. With the guidance that came out last week, we're waiting to hear DAIL's response to what the Cabinet for Health and Family Services came out for the healthcare center. And I'll explain that in just a minute. But that's kind of the gist there. Again, everybody that's in that building, they're screened, they're scanned. If a resident does go out, the resident is screened or scanned. We are doing lots of education on hand hygiene, wearing masks, and social distancing. My staff will tell you, they hear me say hand, space, and face all the time. Make sure you're following those 3 protocols. So that's what's happening at Friendship Towers. We expect to receive some more guidance for in-person visits over there. I would say that's going to come anytime now. And then to the doozy at the healthcare center. So just to hang on. So we received this, it's from CMS. It came out on September 17th. It was a Friday, and it came out Thursday. I believe we got it on Friday morning. And it was really the first piece of guidance that we've received since March that gave us a glimmer of hope that we could have some in-person visits, certainly in a way that we could keep our facility safe, keep our residents safe. But it really was that there might be an end in sight. There's a light at the end of the tunnel. And the CMS guidance came out, and it was really intended to provide reasonable ways for a nursing home to safely facilitate in-person visits to address the psychosocial needs of our residents. I think we can all agree that 6, now 7 months has been a long time for you as family members, for us, and for our residents to be in this in the environment that we're in, not being able to hug and love on each other. We all understand that. So this guidance was kind of our, we were really, really excited about it. In fact, and it's, oh gosh, It's about 10 pages in length. There's lots of rules, lots of different things that we have to go by. But we felt those things were measures that we could put in place that would continue to keep us safe. So what that guidance said was that we could resume outdoor visitations, we could resume activities, we could resume group dining, and we could have in-person visitations so long as we didn't have any COVID cases, new cases within 14 days. Today, I hate to almost say it, but today is our 14 days without any new cases. So we're hopeful that our testing today will produce good results for us. But what that guidance really allowed us to do was get our team together and come up with a plan that was safe, that would allow these visits. And you may have seen us, I believe we were on, gosh, Elise, you'll have to help me, but we were on, I believe it was channel 27, maybe channel 18. I feel like we did a couple interviews when the CMS guidance came out, because it was a big deal for this guidance to come out. In addition to the 14-day requirement, the CMS guidance, and CMS, just to get, again, I want to keep you not so far in the weeds, but CMS stands for Centers for Medicaid and Medicare Services, or Medicare and Medicaid Services. And they are our regulatory agency at the healthcare center on a federal level. So if we don't do what they say, then we get in all kinds of trouble and we don't get the proper funding. That's the easiest layman's way to put it to you. So when this guidance came out, we were really, really excited. They asked us to use the 14-day criteria, as well as look at your positivity rate in the county that you're in. And they gave us a website. CMS kept track of the data and said I believe, Ann, it was every Thursday, we were supposed to look on this website. And if our positivity rate in Fayette County was at a low or medium, there's 3 levels, low, medium, or high. If we were at low or medium, we could have in-person visitations. So at that time, we were in the medium range. Fayette County was at, I believe it was 6%, and the range is between 5 and 10. But anyhow, we were at that range where we could have had in-person visits so long as we had no 14 days and we stayed in that lower medium positivity range for our county. So we thought, shoot, we're going to put our plan together. Our plan was to start in-person visitations on October the 1st. And so we were working with how we were going to schedule them, because there's a ton of things that you have to do before you just say we're going to do it. So we were working on all of those things, and whiplash on September 22nd, the state, which is the Office of Inspector General, and they're part of the Cabinet for Health and Family Services. They come out and with their own guidance and said, in response to CMS's guidance, here's what we want Kentucky to do. And it was, there were a lot of discrepancies between the two, some that we're still trying to figure out. And there were a lot of, it was a lot more rigid. And so what the state guidance has said is, for the most part, they tried to follow the federal guidance, but where they didn't follow it was the timelines. So the federal guidance said you can go ahead and resume activities and dining and off-site appointments, and they didn't have that 14-day requirement. The state comes back and says, yep, now there's a 14-day requirement. So for us, it's which way do we go? And we're going to go this way for hopefully a day before they change the guidance again. But that was the big thing. And then the other piece of it was the state says, no, we don't really believe or feel that the federal data on positivity rates is accurate. We feel like our data is more accurate. And so the state has asked us to use this current incident rate in Kentucky. I'm going to share my screen. I think by now you've probably all seen this map, but it is, hopefully everybody sees it. Nod ahead if you see it. Okay, good. I'm learning this technology. Okay, so this map is what the state is using to determine a lot of things. And I apologize, it's grainy, I expanded it, but there's 4 colors. You see green, yellow, orange, and red. So schools are using this. If you're in Fayette County and have kids in Fayette County or affected by in-person school, you'll hear that schools are using this, sports are using this, and long-term care facilities are using this. So right now, the guidance that we have says that if we have if our county, is in green or yellow, then we are permitted to have in-person visitations so long as we haven't had any positive cases for 14 days. Fayette County is in the red. And so the guidance says if your county is orange or red, then you are not permitted to have in-person visitations. So this was kind of our showstopper when we got the state guidance, because if you're hearing what Dr. Humbaugh, he's the Commissioner of Public Health here in Fayette County, he said so recently as Saturday that he doesn't know when Fayette County will be in green or yellow. So that was kind of a gut punch for us. But this is the way that this data on this map is calculated is it's based on the number of positive cases per 100,000 people in your community. So the critical is if you have more than 25 cases per 100,000. So Fayette County says 26.3 was the data. Now, the other caveat is that our guidance says that we look at this map twice a month. We look at it on the 2nd and 4th Thursday of every month. And whatever the data is at that time is what we use until the next time we look at it. Because if we looked at it every single day, it would be extremely difficult for us to go back and forth every single day. So that is how this is what determines the frequency of not only of how our visitations go, but the frequency of testing when we're testing for COVID at our facility. I'm going to move back. Okay, do we have any questions? I feel like I've been just jabbing. I'm looking. Okay, I see what's the definition of in-person visitation. I am getting right there. So talking about in-person visitations. So right now, because Fayette County is red or orange, we're not permitted to have in-person visits. And that means a family member coming inside the facility to visit their loved one. And there are some exceptions, which we want to make sure we talk about. But at the same time, I want to do it somewhat guarded because we're still working on our plans of how we're going to make this all happen. But an in-person visit is, instead of what we're doing now, which is our window or our Chatterbox visits, that barrier would not be between, you wouldn't have the barrier of the glass. You would be able to, with social distancing, again, there's a lot of different things we have to check off on our boxes, but so long as we check those boxes, that in-person visit would mean you potentially even in room with your mother or your father, so long as they were in a private room. And again, there's a lot of different criteria that we have to meet. But the gist is, in order for us to have any form of in-person visitation, we got to do two things. There's a lot of things that we have to do, but for you all to know, or what we're tracking is the current positivity rate in the county, which is based on that incident map I showed you, and us not having any new cases within 14 days. All of the other things that we have to do, we'll be able to do that without a problem. It's just we may have to modify one of our policies or procedures, but we'll do that in order to make these things happen. So those are the two kickers. The other thing is that if Fayette County is in the red, that means our staff get tested twice a week. And we're doing that this week, and they are not happy, and I'm not happy about it either. It's not a fun test, and it's certainly not one you want to do twice a week. But our staff, they've responded and done a great job, and they know this is what they have to do, not only to keep the residents safe, but it helps them have a pulse on their COVID status as well, so that when they're going home with their family, that they know that they aren't at risk of, what their status is at that moment. So when we test twice a week, those testing dates will be on Mondays and Thursdays. And on Thursdays, the residents aren't going to be tested. So when we're talking about testing twice a week, we're only talking about staff. As far as testing residents go, we only have to test residents if we've had new cases or if we're in that 14-day period. So I know it's confusing as to why a resident gets a test and why one wouldn't. But if we've got a new case, that means there's potential exposure in the building, and we do the testing to make sure that we don't have a wildfire starting somewhere that we don't know is lit, because this thing does spread rapidly once it gets in the facility. Okay, so as far as the in-person visits go, there is a caveat, and that is what our team is working on right now. I know Ann has been working on the policies today, even about what our visits will look like. I always say there's two ways to skin a cat. So while we didn't like the guidance that came out about us using Fayette County's data, nobody in Fayette County right now is liking this data, because it's saying that they can't go back in school. There's a lot of things that hinge on it. But there is a provision in this guidance that allows for compassionate care visits. And prior to this guidance, the definition of compassionate care would be a resident who is at the end of life, or they are in that dying process, and we want to encourage their family to come in and be with them and kind of spend those last moments with the resident. We are excited that the compassionate care visits, that definition is expanded, and it's expanded to include, and if you'll just hang on, I want to make sure I don't tell you wrong, because there's several different, it's expanded to include, there's 5 different qualifiers. And so before I go over what those are, what I want you to know is that our team is actively looking at each resident to determine if the resident would be a candidate, if you will, for a compassionate care visit. So I know that's probably the burning question is my mom, my dad, my loved one going to get a compassionate care visit? And we're working through that right now. Our director of nursing and Ann are going through that. So a compassionate care, and I apologize, I want to make sure I tell it to you correctly, so I'm going to read it to you. Is a resident that was living with a family before recently entering a nursing home, or struggling with the change in environment and lack of family support. So residents that are newly admitted or to the facility, because our new admissions, they're in isolation for 14 days. That would be a situation where we could say this is a compassionate care visit. If a resident is grieving after a friend or family member has recently passed away, that would constitute a compassionate care visit. If they need cueing or encouragement with eating and drinking that's previously been provided by a family member or a caregiver, or they're experiencing weight loss or dehydration, that would be another situation that would constitute a compassionate care visit. If they're used to talking to and interacting with others, and they're experiencing emotional distress, or they're crying more frequently, that would be. And I think all of us, I need one of if that would be the one that would apply to me, that we're certainly, this has been a stressful time for all of us, but certainly for our residents as well. Or if they have had an affinity for a familiar domestic pet, and they can even have a visit with their pet, that would be a compassionate care. So I think the intention of this guidance was to allow more flexibility. For us, that's a challenge, because we're so set on, these are, typically we're given rules to follow. So we're kind of dealing with a black and white situation where this allows so much more gray. So because there's so much more gray, that just means that our team has to be extra cautious and making sure we're doing everything we can to facilitate these compassionate care visits, but yet still keep everybody safe, and still keep the facility safe, and still follow the guidance. Because if the state or regulatory agency were to walk in the facility, they're going to want to see who all has had visits, And why have they had visits? Because there's still a notion that this virus does exist, and it can be detrimental in a facility such as ours. So we got to make sure that while we want to have that flexibility to make these things happen, that we still follow our guidance, that we're doing everything we can to keep everybody safe. So that's kind of what we're working through right now. I know Ann and I, we were trading correspondence earlier, and she's working on this visitor entry policy. So because the guidance says you can only have one person at a time. It has to be in this certain area. It has to be during these certain, I mean, there's so many extra add-ons to it. We've got to figure all of that out. So what our plan is immediately is we're going to continue to focus on what the incident map says, but we're also working on how we can make compassionate care visits happen for as many of our residents as we can, because we believe and we agree that it's been too long and you guys want to see your loved ones. So we certainly know that. Okay, so I think I have covered, there's a whole bunch more jargon in this guidance, but it's really, again, stuff that that's our job as administrators of the facility to make sure that we have in place to keep everybody safe. And your job to trust that we're doing that. And we are doing an exceptional job. We've had 2 targeted infection control surveys where the state has come in and have said, show me what you're doing with COVID. And we've not received any deficiencies, and they've been very, very impressed. Obviously, we've just been trying to do a very good job of being transparent and telling you guys everything we're doing every step of the way, because we know it's hard for you to have to not know what's going on from the outside looking in. So that's why we're spending so much time making sure we show you all the ways. You'll see the hashtag that love still gets in. So I'm going to go through, and I have a couple questions that have come in via email before. So I want to make sure, if I haven't already answered those, that I do. Let's see. Somebody wanted an updated list of appropriate persons to contact with specific questions. We will make sure that we post an updated contact list. We do have folks that have picked up additional duties that are doing things more. Hold on, somebody's coming in this meeting and I don't know how to let them in. There we go. We have our staff are wearing many, many hats. So we'll make sure we get an updated contact list posted on our website for you. Elise, you're muted.
Sorry. I'll also address that if you do have a specific question at any time, day or night, you can call the COVID information line and leave us a message. And if you leave your name and your phone number and resident name, someone will get back with you in a very timely manner. So if you want to skip everything and go right to just, hey, I just want to leave my message and get somebody to call me back, that's a great way to do it. The phone number, if you have a pen handy, is 859-899-0831. And that's always at the top of our COVID information website page as well. And I'll type that into the bottom comments here.
Thank you. The other question was, are there circumstances to allow visits for those residents who have regressed emotionally and physically? And yes, that's what's those compassionate care visits. So if you see the term compassionate care visits, that's our way of figuring out how to make this happen, that we follow the guidance that the state has set out for us. Because while the state and federal guidance differ, we're supposed to follow the most strict guidelines, and the state agency is the one that's going to smack our hands if they come in and we're not doing what they're supposed to do. So we want to make sure we're always above board on that. Let's see. So let me go back. Sorry. The visits, there's a question about visit at Friendship Towers that's today at 4:30. Can I go in the lobby, or should mom just come outside? I think they're doing that. As much as we can encourage outside, we like to do that while the weather is decent, because again, that just minimizes the risk. But we have the provision for those visits to happen in the lobby. So do we want residents, family members to reach out to request the compassionate care visit if you think that their family member meets the criteria? What I would ask for just is a little bit of grace. We just came up with a plan and we still don't have it finalized, but know that we are actively working to make this happen. Again, if you want to make that request and want to just call the COVID information line and leave that information on our line, we check that line several times a day and respond to it, so we can make sure that we have that information. But do know that that's exactly what we met about it on Friday, and Ann and her team are working through the process right now to figure out who would benefit from that. And we have a really good idea of who those individuals are. And we're going to try to make, again, I think there's a way that almost every resident here at the healthcare center, we can find a way to call it a compassionate care visit. And I don't mean we're doing anything squirrely, but again, there's enough wiggle room in the guidance that allows us to do that. We just have to follow a different set of rules for that than our traditional in-person visits. So we have to schedule them. Anyways, there's all kinds of stuff we have to do. Let's see. What are the dates that the state map is assessed? Great question. So our guidance says that we have to look at the state map on the second and fourth Thursday of every month after 8 p.m. So what we're doing is the map I showed you was the data from whatever Thursday was. I'm sorry, I'm having a brain freeze. I think it was the 24th. Yeah. Oh, here it is right here. was the data from the 24th. And so what we're supposed to do is we print that out and we keep a record of it. So again, if the state should come in the building, they will want to look and see when was the last, incident report that you printed and what did you do? Did you test twice a week? Did you do the in-person visits? Because it drives our in-person visits as well as our testing frequency. So we look at that, and it's, I said to the team this morning, I said, what stinks is on Friday or Saturday, Fayette County went down to the orange, which meant we would only have to test once a week, but we've got to follow it at that snapshot in time, which it was red at that time. So we'll look at it again 2 weeks and a couple, on the second Thursday. I've got my calendar marked at 8 o'clock every night to look at it and take a picture of it and print it so we know what our status is, and we'll start posting that information on our website as well as so that if you have questions, you can always go there. Let's see. Sorry, I'm trying to scroll down. Elise, is there anything any questions coming from Facebook?
Not from Facebook, but I do see a couple new ones that just came in. So we can still bring our Friendship Tower family members out to visit in our home, and then in parentheses, even with the higher rate in Fayette County, is the question.
That is correct. So the guidance for assisted living does not have us go by the county data. So the red map, what basically it says is if there's 3 things we have to do. No new onset of cases in 14 days is one of those. So in the event Friendship Towers gets a new positive case, we would dial back those at that point. But Friendship Towers, because it's under the regulatory agency for Friendship, has not come out and said they don't follow this tier map like the Office of Inspector General does for the healthcare center. So the short answer to that is yes, you can still do that. We'll screen and scan the resident, obviously, when they leave and when they come back, and make sure we're providing lots of education, encouraging them, again, face, space, and hands, that they're following those 3 criteria. Let's see.
The next one is the new expansion apartments will fall under the jurisdiction of which federal agency?
That will be the Department of Aging and Independent Living. They are part of the assisted living facility.
Okay. And when do you think compassionate visits may start?
Again, we've got to finalize our plans because those visits, they do have to be scheduled. There's going to be some traffic patterns that we're going to have to establish because we're only permitted to have so many people in the building at a certain time. We have to designate hours. Trust me, as soon as we can get it done, we want to get it done, and we're actively working on it. I hate to say a date because number one, right now we are waiting on test results for today. So if I said tomorrow, then I may have to come back tomorrow and say, we've got to dial that back because we have a new positive case. So, but I would anticipate the next few days, we want to make these things happen. I promise. So badly, we want to make them happen, and we will.
What screening do you anticipate? And do you anticipate any additional screening or requirements for out-of-state visitors?
So we have been following the state guidance on travel advisories. So right now, there is still an active executive order in place that if you go to an area that has a positivity rate that's above 15%, that you should do a 14-day quarantine. That will be part of our screening process. We're going to ask, again, a lot of family members, while they want to see their loved ones, there is some hesitation to come in the facility because you don't want to certainly be, inadvertently the one that brings it into the facility. But we will educate our family members just as we do our staff about what needs to take place or what things. You can't have a temperature. You can't have, there's a lot. We do a questionnaire of our staff every single time they come in the building. We'll essentially, our visitors will adopt that same screening process where we'll take their temperature. We'll ask a series of questions. We'll provide education on COVID. We will ask that if you've been in any high travel area that has that positivity rate, that you not come in. And we're going to encourage, while the weather's nice, Anne has just ordered some heaters for outside. So we're going to encourage some of these visits to take place outside. And that checks a lot of boxes for comfort for our family members too, because we have several families that have said, I want to see mom or dad, but I really want to stay outside because I don't want to certainly be any risk to mom or dad or others. So let's see, did I answer that? I think I answered everything.
You've got one from Facebook. Can I come to the healthcare center and take my mom for a sightseeing ride?
Not right now. The restrictions do say that our residents can leave for medical appointments, appointments that are medically necessary. Now we have had a couple of situations where depending on, and this may be a better question for Anne, we've had some residents that have gone home or have gone out, but when they come back, they do get a COVID screen. Anne, do you want to answer that one? I can't. There we go.
Sure. Yeah. We if you have a resident that has, or a family member that is covered under Medicaid, there is a 10-day leave of absence per year under Medicaid, where Medicaid will hold the bed for up to 10 days. So there's been a few situations where we suggested, maybe taking the resident home for 10 days or 5 days or whatever, and that is allowable. The negative side of that would be once they came back, they would have to be in isolation for 14 days. And basically what that means is they won't be able to come out of their room. They'll have to stay in a private room, maybe be moved into another room if they don't already have a private room, and be retested again. And they can't come to the window visits. So you just kind of got to weigh the good with the bad. And, if you're in that situation and you're wondering that, please give me a call or call your social worker, and we can kind of help walk you through that to help you make that decision.
Thank you. And the goal is that there could be potential exposure for that resident while they're out. So we treat that as a 14-day quarantine inside the facility to just mitigate any risk for any of the other residents or staff. But we've had that on a handful of times. Again, you have to do a risk benefit analysis, but I encourage you to reach out to Ann or her social. Vicki's on here. I see Vicki. I think I saw Kim on here. And I don't know if Michelle's here, but reach out to one of the social workers and they can help really go over the risks and benefits of that type of visit.
One kind of ties into that. What about holidays though? I was thinking of taking mom home from Thanksgiving to Christmas, so this wouldn't be possible, or can she quarantine in between the holidays? If say you go home for Thanksgiving, come back quarantine, go home for Christmas, quarantine.
It looks like that this is coming from Friendship Towers resident. And again, they have more flexibility right now because, again, at Friendship Towers, everybody has their own apartment. So if there's a need to quarantine or kind of isolate from everybody, the residents there have apartments that they can go into. It's just not the case here at the healthcare center. It's so much more of a congregate setting. So in that situation, yes, we could make that accommodation happen. And that would be a question for Joe and his team, but certainly we can make that happen. And we'll have to see, obviously, I mean, who knows what Thanksgiving, that's also that's an eternity for us right now. We tend to look at just today because we know this information changes so frequently, but based on what we know today, again, depending on what the status of the COVID status of our facility is, I think there's many ways to skin the cat to make sure that we provide an environment that's safe and that meets the psychosocial needs of our residents as well. Do I have any others, Elise?
When will the Chatterbox schedule be up? And that is Adrienne Nichols is actually taking those calls on, if you call it 859-271-9000, she's keeping that track of all of that because it just seems to be a better process. If that technology is glitchy, and if she's keeping it all, she knows exactly where to move the parts and pieces so that we don't have any downtime. So if you want, or if you have any questions about that, you can either email her at anichols, ANICHOLS @SARE.us, or call 859-271-9000.
And Adrienne is scheduling the visits at the healthcare center at Friendship Towers. Those are still being done online, scheduled online through Angela. And I know it's tricky because we've changed our protocol and made it difficult for you all sometimes to get these things scheduled, but we'll put a calendar out there and then 2 days later the guidance will change and we'll get a positive case and we have to dial back. So we made the decision last week, again, with so much change in the regulations, just to go back to the old school way of doing it, pen and paper, and she's scheduled them and she's doing a fantastic job. I know she's calling and giving reminders, and she's done a great job of making sure everybody knows what their schedule is for those visits now.
And do one for Lisa McIntosh. Can the number of Chatterbox visits be increased? Any other space that can be converted?
So right now we have, I believe, 3 designated areas that we're using for our Chatterbox visits here at the healthcare center. And the challenge has been that prior to COVID, we didn't have Chatterbox visits. And so we've got Tyler Green, who is our chaplain. We've got additional staff members that are in here covering those. But that's kind of above and beyond of what we were used to having in terms of staffing. So, and we use our activities team as well. And so now that activities are able to resume, we can do some in-person activities. We're trying to, we look at this on a weekly basis to see how many more of these that we can do. We've added some on the weekends, we've added some in the evenings, because we know that there just aren't enough hours in the day to get them done. But we also have to balance what our staff has the capability of doing. We did have a couple situations where we had residents off of our dementia that are on our dementia units have window visits, and they were in the evening, and that's just not an optimal time for a resident with dementia to have a visit. So we're trying to work. There's so many different variables that we have to look at within the Chatterbox visits, but I know that we'll continue those as much as we can, and we'll continue to do the virtual visits just any way that we can. But if you have trouble, or if you're finding it difficult to get one scheduled, by all means, reach out to Adrienne, and she will make it happen for you. I've seen her work miracles. She'll be able to get that done.
Janet King asks, compassionate care visits can be scheduled for Friendship Towers residents.
So right now, we're waiting on Dale to weigh in on what they want us to do as far as these compassionate care visits. As soon as we get that guidance, we will again make that happen, but I expect they'll kind of follow suit. And again, if there's a situation where those, that criteria I read off that you're thinking that's me, that's my mom, that's my dad, in that situation, reach out to Joe Drum. Sorry, Joe, wave your hand. Reach out to Joe and his team. And again, where there's a will to make these things happen, we want there to be a way. We just have to make sure we're following our rules, not our rules, but the rules that we have to follow by our state and federal regulatory agencies, by the CDC, by public health. And if we can do all those things, we'll find a way to make it happen. I don't.
That's all the speed.
Is that all of them? Okay, well, we're right at an hour. So that's almost too long for a Zoom call to hold your attention. But what I will do is I will hang on and answer, and I'll ask my team to hang on and answer any additional questions that you all may have. As again, if you have any other questions or something, this is one of those things that after the fact, you'll say, I meant to ask that and I forgot. Just don't hesitate to reach out to us. I know that the CMS, and Elise, you'll have to help me. I'm pretty sure we've posted all this guidance on our website. It's there for you to read.
And I'll put 2 more links of it right at the top today.
Okay. So if you're bored, if you're having trouble, I always say, if you're having trouble going to sleep, or if you need something to do while you're in the restroom, it's great material to read in those 2 cases. But otherwise, you can just count on us, the fact that we're combing through it with a fine tooth comb to make sure we do everything that follows the guidance. And then again, like I said, still keeps everybody safe. All right. Well, I so much appreciate everybody's time, and I hope everybody has a great rest of your day. Like I said, I'm going to turn off the live Facebook feed, and I'll hang out with my team for a few minutes if you have additional questions. Otherwise, I hope everybody has a great day.